Hello everyone, welcome to our channel. Zethu is back. Question: do you know that irritable bowel syndrome is one of the common chronic bowel conditions? Let's talk about it. What is irritable bowel syndrome? Irritable bowel syndrome is a functional bowel disorder that occurs in the large intestine or large bowel. It is slightly common in women than male. It usually starts in early adulthood, although it can start at any age. Irritable bowel syndrome presents differently on each and every individual. Therefore, it is difficult to pinpoint to everyone who is suffering from the condition what they can avoid. The triggers are also different from each and every individual. The cause is unknown, but there are some factors that are associated with this condition. One of them is the poor regulation of the muscle contraction of the digestive system. The second one is a greater sensitivity of the nerves in the digestive system. And another cause, it can be a problem in connection of the nerves between the brain and the digestive system. Stress is one of the triggers of the condition, as well as the food sensitivity. What are the signs and symptoms of irritable bowel syndrome? One is the abdominal pain and cramps. You'll find that someone is having this severe abdominal pain and cramps, and in most cases it is relieved or it becomes less severe after someone had a bowel movement. Diarrhea is another symptom. Diarrhea will last for some days. Another symptom will be constipation. You'll find that someone is having bowel movement that is less than 3 days a week. Gas and bloating. Because of that gas, it also causes a lot of discomfort. There will be a change in bowel movement. You'll find that somebody at times cannot even be able to control her bowel because it doesn't know when it's going to come. Fatigue. It is also one of the symptoms because this person is not sleeping well. Anxiety and depression. Because of all this that is happening to this individual, and the person become anxious and you also become depressed. How this condition is diagnosed. Once somebody goes and visit the doctor, or once somebody goes and visit the clinic or hospital, it is important to take the history from the sufferer. History taking is important so that you can identify the symptoms that this person is suffering from. A physical examination will be done, and the doctor will also do quite a lot of tests to exclude the other condition that can cause all these symptoms. What is important for the doctor as well, it is to check on the patient whether he's not having any alarming symptoms. Alarming if there is blood in the stool, that is alarming. That will actually make a doctor to think. But it is always advisable that all the tests can be done to exclude things like malignancy. But what is happened here, after all doing the test, you'll find that all the test comes back normal. That is the only way the doctor will come out with the diagnosis. All the tests are normal, but the person is suffering. It means there is something wrong, but although all the results are normal. There are types of irritable bowel syndrome. One of them can be characterized by diarrhea. That one will say irritable bowel syndrome, predominant diarrhea. And the other one can be characterized by constipation. That one, it will be irritable bowel syndrome predominantly constipation. And another type, you will find that the patient is having diarrhea for some days. Once that diarrhea stops and the patient start having constipation, and that type we call it irritable bowel syndrome mixed, because it's diarrhea and constipation. As all the tests are normal, that is the only time that the doctor will be sure that it is irritable bowel syndrome. Otherwise, it is not easy to diagnose this condition. You have to exclude all the other conditions. But how do you exclude all those conditions? By doing all the tests that you think may be necessary for that patient. And in severe cases, maybe you can even do endoscopy and you can even do colonoscopy. But in irritable bowel syndrome, all the test becomes normal, although the person will be still suffering. What is the treatment of irritable bowel syndrome? The most important thing here is the health education. The patient must work hand in hand with the health workers. Patient must understand her condition or his condition. On irritable bowel syndrome, you treat the symptoms. There is no specific treatment. If the patient is presenting with diarrhea, you will treat diarrhea. If the patient is having a irritable bowel syndrome that is characterized by constipation, the patient will be given the stool softness. The diet plays a major role. Doctor may end up referring the patient to the dietitian, and the dietitian will actually draw a plan what the patient can take and how the patient can take whatever that is ordered on her diet. The patient must know which is the food that triggers the condition. Once the patient knows what is triggering the condition, the patient will be able to avoid those triggers. When it comes to diet, the patient must have regular meals. When you are having your regular meals, take time when you are eating. Take a lot of fluid, especially water. Try to avoid things like caffeine and try to avoid things like frizzy drink. And the patient is the one who will actually know better than everybody. But all this, the patient will also know will be able to cope with the situation because he knows more about herself, and he also knows more about things that are not good for him or that are not good for her. Psychological treatment. Because of this condition, you'll find that some of the patient may be depressed. They need family support. The patient can also referred to some group therapy and mix and discuss with those people that are having the same condition and how are they coping with the condition. Patient must learn to have some coping skills if she feels that she's affected badly by the condition. Stress management is also important because stress is one of the things that can trigger irritable bowel syndrome. Physical activity is another important thing that the patient can start slowly so as to keep herself or himself fit. There is quite a lot of things that the patient can try just to relax her mind or his mind. But with the family, it is also important that the family, the health workers are all there to support the patient. Irritable bowel syndrome is not a life-threatening condition, although it's not an easy disorder to manage. That is the only consolation, that it's not possible that you may end up having a cancer. That is important that the doctor will do all the test to exclude any condition that can follow. It's not life-threatening and it's not contagious. For today, we will end up here. If you do like these short videos, please subscribe, comment, and share. Thank you for watching. Till next time, stay healthy and stay safe.